My presentation is on the effects of Whirlpool use on patients with complex regional pain syndrome. Um, I looked up a couple different studies that had a bunch of different things with Whirlpool usage. There was a lot of different things that were hard to find specifically for just occupational therapy. But I was able to find some things that were in physical therapy journals that could relate specifically to occupational therapy and what we do. Some of them were like things that would happen to football players. One of them was where a football player had an elbow injury and they used therapeutic exercise with the addition of Whirlpool. I guess I think they were using cryotherapy to do that one, and it had some significant effects on his progress and healing on his elbow. Um, Today we are going to be going over a specific article that's called it's called the effects of Whirlpool bath and neuromuscular electrical stimulation on complex regional pain syndrome. It's basically it was a comparative study. But before we get into all of that, I'm just going to give you a brief overview of how we use Whirlpool therapy in our practice. It's basically its method of heat exchange is convection, which from our book states that it's of heat, conveyance of heat by the movement of heated particles over an extremity. There's two different ways to use Whirlpool therapy, so there'd be cryotherapy or thermotherapy. We have it labeled in class and in the book as superficial heat for thermotherapy, but it also states it in the book as thermotherapy as well. So for cryotherapy, it's most often used for edema reduction and wound debridement. It's used in conjunction with compression wrapping, mostly used on hands and digits. The benefits are constant contact with target tissue. Some of the disadvantages are the dependence of the hand in specific positions. And the temperature for cryotherapy would be between 35 degrees and 75 degrees Fahrenheit. So for thermotherapy, superficial heat, it's most often used for wound care and chronic ulcers or wounds, similar to cryotherapy. So inflammation, pain. It's used when mild, moderate, or vigorous heat is desired. It works in conjunction with an antimicrobial agent added to the water. And that's to help debride and clean the wound. Its benefits are gravity eliminated positions for active movement. So usually when we do Whirlpool therapy, we want to do active movement stuff in there. Some of the disadvantages are the dependence of extremity in limited positions. The temperatures can range from 79 degrees Fahrenheit to 109 degrees Fahrenheit. But for wound debridement, it would be between 92 and 96. So here, let's get into the article that we went over. Like I said, the name of it was "The Effects of Whirlpool Bath and Neuromuscular Electrical Stimulation on Complex Regional Pain Syndrome." The purpose of the study was to investigate and compare the effects of Whirlpool bath and neuromuscular stimulation on patients with complex regional pain syndrome. It was conducted in Turkey. The experiment took place in 2014, but the article wasn't published until 2015. It's level 1 evidence, specifically because it's a comparative pre-test post-test design that both groups were randomly picked to be put into their groups. So it didn't label it as a randomized controlled trial, but it is because they were both put into groups separately and randomized. I thought it was really interesting that they were trying to compare the two. Like I said, it was kind of difficult to find just one specific article on only Whirlpool therapy. But that's why it's labeled as level 1 evidence, because of that. Although there weren't over 100 participants, it's still labeled as level 1 evidence. Some of the inclusion criteria of this study are participants who were in the first stage of type 1 complex regional pain syndrome of the upper extremity. And some of the exclusions of this study would be participants who had a medical history of peripheral neuropathy or nerve lesion, systemic disease such as diabetes mellitus, and a current infection or tumor, previous history of hand fractures, or presently containing an open wound on the hand. The methods of the study. So in this study there were 60 total people who participated, 30 in each group. There were more females than there were male, and this is because some of the literature shows that there are more females that are diagnosed with chronic complex regional pain syndrome than men. The average age of the participants was around 39, so it was between 28 and 56. They were mostly right hand dominant and had symptoms of CRPS for an average of 5 weeks. The participants were randomly selected into 2 different groups and given different comparative interventions. Group 1 was given Whirlpool therapy. Group 2 was given the NMES. And they both were treated for 15 sessions for 3 weeks. So they had 1 session per day for 5 days a week for 3 weeks. The only difference between the two were really just one was getting Whirlpool, the other one was getting neuromuscular electrical stimulation. But along with that, they were both getting additional treatments as well. So they both had underwater ultrasound treatment, therapeutic exercise, in addition to Whirlpool therapy in group 1, and then underwater ultrasound, therapeutic exercise, and NMES in group 2. So with the Whirlpool bath, they used a Chiron extremity cauldron for 30 minutes at 104 degrees, which is optimal for therapeutic benefit. It has to be between 104 and 113. Group 2, they used the CFAR device for 20 minutes on each muscle group, so they had to do it for 40 minutes, but 20 minutes for flexor and then 20 minutes for extensor for the electrical stimulation, and it was at a rate of 30 hertz per 300 milliseconds. And like I said, they were both used with ultrasound and therapeutic exercise. The outcome measures of the study are pain, grip strength, edema, range of motion, pinch strength. The pain was measured by the visual analog scale, which this was a subjective outcome measure, because what they did was they basically just drew a 10 centimeter line on a paper and put 10 X's on there and had the patients rate their pain pre-test on the scale, and then they also rated it post-test as well. The grip strength was objective, and they used a hand dynamometer in kilogram force in the optimal position. They took 3 measurements and had the average of those 3 and recorded it. Edema was also objective. They used a volumetric cylinder, and they measured it in cubic millimeters of overflow of the fluid, and compared it to the non-affected extremity. Range of motion, the participants used a objective measure, so they used a hand goniometer to measure wrist flexion and extension, and they also used a tape measure to do finger to palm crease distance to see what their range of motion with that was. Pinch strength was also objective, and with pinch strength they did a lateral grip, a 3-point grip, a fingertip grip, and they used a manual pinch meter, which was measured in kilograms. And this, as I said, was also objective. Took 3 measurements, and the average of the 3 were recorded. The results of the study, some of the special tests that they used were a t-test, the chi-square test, a Kolmogorov-Smirnov test, a Mann-Whitney U-test. These were basically just to get a comparative data to compare the neuromuscular electrical stimulation with the Whirlpool data and determine which benefited CRPS most. The conclusion of this study was that at the beginning of the study there weren't any statistically different parameters between the two groups, Group 1 and Group 2. The outcomes were measured pre-test and post-test to determine differences in effectiveness. After the 3 weeks, results showed that the use of Whirlpool bath as a physical agent modality on patients with CRPS had more statistically significant advantage over NMES for patients with upper extremity symptoms. All outcome measures were the same. All outcome measures were more directed towards Whirlpool therapy, except for lateral pinch strength, which was the same between both. Some of the strengths of this study were the interventions that were performed. They were performed the same time, same duration, and they were used with the same additional interventions as well. But that was also some of the limitations of the study too. I thought that instead of just using Whirlpool or NMES specifically, that kind of limited the outcomes of the study, because we weren't really sure if Whirlpool, in addition to the therapeutic exercise and underwater ultrasound, worked, or with NMES, underwater ultrasound and therapeutic exercise. I felt like if they had singled them out, it would have probably given a little bit better data to compare the two and see what really helped benefit these participants better. Some of the important concepts with this: how do the results of this study apply to occupational therapy practice? Well, as occupational therapists, we will be dealing with a lot of CRPS patients and a lot of symptoms that are similar to this. So this is something that we'll be able to use in our interventions that we advise our patients and guide them in as occupational therapists. Some of the gaps in the research, that I feel like is something that has to do with limitations. Like I said, it wasn't singled out, so it was kind of difficult to tell what the difference between both of them were, just by singling them out. More gaps in the research were there weren't really a whole lot of specifically occupational based research articles on function from Whirlpool. It was more of alleviating symptoms of an impairment or a disease or something, besides getting someone back to function of their arm or doing something functional, ADLs, feeding, eating, dressing, anything like that. There wasn't a whole lot of information that I could find on that. It was more physical therapy based, and it was more athletic training based. Some of the additional research, I feel like that has to go along with gaps in the research. We could really use more research on Whirlpool therapy and see what some of the benefits of it are to improve functional status with patients and improve their function for occupational therapy. I plan on using the results in this study in my own practice by being able to relate this article to my patients and show them that the differences between eStim and Whirlpool show that specifically with CRPS patients with an upper extremity, that it would help them increase, improve and progress faster, or have better outcomes with Whirlpool therapy than electrical stimulation. I would like to use both of these modalities on other patients with different impairments as well. But that's since this is really all that I've seen so far, this is really all that I would be able to apply with something backing it up as evidence-based therapists. So that's all I've got here. Here are my references, our little modalities book, and the article that I got. So thank you for listening, and that's all I've got. Thank you.